Dr. Christ tasked us with the idea of making a public health summit to bring our partners together. Here's what we want to accomplish today. So we'll look for creating a common statewide concept of operations. We want to share knowledge and understanding of Zika, and we want this forum to help us coordinate our efforts.
I would like to introduce our Director of Health, Dr. Cara Christ. We are extremely lucky to have such a fantastic director here in Arizona who is so fully committed to public health.
So what is Zika virus disease? You've been hearing a lot about this. There's a lot of information in the news. CDC has been calling this an unprecedented disease. It is an arboviral disease, which means it's spread by mosquitoes. It's vector-borne. And we've been watching it actually for quite a while. When you look at global health security, we know that infectious diseases are just a plane ride away. And what we need to understand that infectious diseases that happen in other parts of the world can happen here in the United States, can happen in Arizona, and we need to be prepared. And Zika is one of those diseases. Local transmission is actually when it is being transmitted from mosquitoes in a specific area, which is different than an imported case. So these are your travel-associated cases. These are people who traveled to a country where it is being transmitted, were infected, and then came back to their home, and then came down with symptoms and were diagnosed at home. So now we're at the next steps, planning, Zika planning and response. This is your opportunity to give us feedback. We just really appreciate you guys spending the day with us today, so thank you for joining us.